I've wasted so much time trying to connect to a phone banking executive or trying to sort out the various IVR menus. I'm honestly surprised I've ever managed to get any banking work done. Thankfully, now with the Jupiter Digital Banking app, these things are finally in the past. Their super easy to use app simplifies banking in a way we've never seen before. They have a 24/7 chat bot live on their app, which connects to a human within seconds if you need. In case of more complicated interactions, you get a ticket number which can be tracked to determine where your query or complaint is and by when it can be resolved. So check out jupiter.money to find out more or download the Jupiter app on Android and iOS to get started. Hello and welcome to the Habit Coach podcast. I'm Ashdin Doctor, your habit coach, and today it's Anti-Tobacco Day. Now, we're going to be talking about tobacco and the harmful effects of smoking. Now, I know we all know about these things, but what are the actual effects that are taking place in our body? It's important for us to understand the science behind it so that we can make better choices, we can help our family make better choices, and ultimately, better habits lead to an awesome life. So, with us, we have an expert, Dr. Richa Mittal, to join us and discuss about anti-tobacco. Dr. Mittal, welcome to the Habit Coach podcast.
Thank you so much, Ashton. Hi, everyone. I am
I'm very,
Dr.
very
Richa.
excited about this conversation. Thank you.
Same
Dr.
here.
Mittal, tell us a little bit about yourself.
So, I'm a pulmonary and sleep medicine specialist at Sir Richa and Reliance Foundation Hospital. And yes, I specialize in the respiratory and chest disease and also sleep medicine. And today we are going to discuss on this World No Tobacco Day that we are going to discuss about smoking, its hazardous effects, and yes, all the other aspects.
So, doctor, when you started your career in pulmonology, and did you have you noticed a difference in the kinds of people that are coming in now with regards to tobacco or smoking and back then? Is there a shift?
Yes, very much. So earlier we used to get a lot of cigarette smoking was always prevalent. There was BD smoking also. It's still there, but it's much less probably. And hookah smoking used to be there only it was limited to maybe more or females and people who are coming from villages. And I often used to get that we smoke hookah because we're constipated, and that's how tobacco helps. It helps with your motility of your bowel, and usually it was more prevalent in villagers and females for that matter. But now with the shift I have seen, people come with vaping, adolescents, youth. Hookah smoking is very much prevalent in the youth, and it's there in the urban cities and everywhere. And cigarette smoking, yes, it's been there always.
So even
Bidi
hookah is still
smoking,
increasing.
yes, very much. And I think I think that's what I've observed, that it's more hookah smoking, and people don't really, when you ask them about tobacco history, they won't really tell about hookah smoking because they feel and they believe that it's harmless, but actually it's more harmful. And so they don't even give the history. You really have to dig deeper, and you have to ask them those questions, and then only they tell. So yes, it's
And
more
it's so
much more
true
prevalent,
because hookah
especially
is
in
now out in the open and it's considered one of those things that are okay to do. But like you just said, it's far more harmful.
it's far more harmful. So it's proven. We have substantial scientific evidence to say that, because you see there are multiple things. When there is one session of hookah going on, there are multiple people sharing the same food pipe, the same water pipe. Then you take a lot of inhalation to, you take a lot of puffs in one go only. So in just 1 hour session, it's actually backed up by evidence that in a 1 hour session you inhale 100 to 200 times more smoke than you would inhale in just one cigarette.
My God.
And actually, the nicotine, which is the addictive substance that you are inhaling, more than what you will inhale in one cigarette. And in hookah, what's happening? There is high heat. So the charcoal is burning and it will produce carbon monoxide, which is very harmful. As a gas, it's very harmful to your body, and you are inhaling it 9 to 10 times more than what is being produced in just one cigarette. So it's much more harmful than cigarettes because you tend to inhale more. There is high heat and too many puffs are going on when we don't realize,
Mm.
and we inhale hookah for a very long time. It's always an hour or 2 hour session that's going on.
Correct. So whole evening, that's how it started, right? People bonding together and a whole evening like that.
Yes, yes.
So what are the different elements of either smoking with cigarettes or hookah that are actually causing an effect in the body? So you mentioned a few things. Mentioned carbon monoxide, heat, etc. So are there a list of things that are causing a damage to our body?
So there are numerous. Let's not go into the details of that. But yes, to highlight a few, there's nicotine, which is the addictive substance. That's what binds you to cigarettes, and that's the psychological that's where you get that psychological addiction to cigarettes, to smoke. Even the smell of smoke will make you feel, and that craving for smoking a cigarette. That nicotine is the one which give you pleasurable effects also. Euphoria. You feel good about yourself. You feel better. You feel smart. And it's actually proven that, smoking makes you feel intelligent also. It activates the brain receptors. So that's for the addictive and the pleasurable effects, nicotine. Then there is tar, which is the most harmful, and it is responsible for your teeth staining. It's one of the toxic elements, and sort of responsible for all the cancers and the malignancies in the body. Then there are multiple compounds that are released from the smoke itself. Carbon monoxide is just one. There are many other toxic components that leads to the change in the cells in your body and leads to the cancerous growth. Now, smoking can cause, and tobacco for that matter, can cause cancers in anywhere, in any part of your body, from head to toe.
Oh, it's
From
not just lungs or mouth or.
No, so that's the most common one.
Hmm.
So oral cancers, throat cancers, lung cancer, cancer of your food pipe, cancer of your stomach, cancer of your urinary bladder, liver, pancreas,
How does it
everything,
reach where?
kidney. So you're inhaling, and then it's being absorbed in the blood. So that's how. So we tend to think it's just restricted to our lungs
Correct.
because that's where the smoke is going. No. So our body keeps surprising us actually. And
And
smoke, what it does is basically it decreases our body's immunity.
hmm,
It decreases our body ability to fight with anything. So if there is a cancer cell anywhere, our body will have a reduced response to that, and it will not act properly. Also, it modifies our body cells. It produces changes. So those and leads to cancerous cells also, and that can be anywhere in the body. So from
and
head
these
to
are
toe,
because of the chemicals or these are because of tar? What is the.
chemicals. So there are multiple toxic chemicals that are released
Hmm,
after from smoke.
okay. So
Yeah.
so because of the chemicals, it could cause these reactions in the body.
Yes. Yes.
Now,
So
when we
nicotine
talk.
is just the. Yeah. I'm so sorry.
Hmm. No, no, no problem. You're saying nicotine is just the addictive element in it.
Yes. Yes. So there are hundreds of toxic elements that leads to these cancer and multiple other effects, adverse effects.
So normally when people talk about smoking, they immediately think about tar and black lungs, and that is what we've seen on in our movies and when it starts off with them. So then they think vaping is fine because in vaping you don't necessarily see the tar, you don't see any of that, and it's considered healthier, right? What is the whole funda of vaping?
Yeah, so when it was launched, also vaping, and when the e-cigarettes came into market, it was thought to be safe. We all believed that it was safer because ultimately, what principle it is working on? That in a smoke we are burning, whereas in e-cigarettes we are giving nicotine, but we are just aerolizing that nicotine. So we are not burning it up. We are just heating up and causing the vapors to be there.
Correct.
So it was supposed to be safe, but then, and in the studies also, we have seen it's a good way, it's a good modality for a person who's trying to quit smoking. And we've seen abstinence in study for it for 6 months, also for 1 year, also once who start using e-cigarettes. But then recently, just 2-3 years back in 2019, came reports, especially in youths, that there are multiple elements that are there in this nicotine. They are flavoring agents. Then they vary in the amount of nicotine they are delivering. They are vary in the rate of the nicotine they are delivering. And there are multiple oils also. Vitamin E is one of them, and there are many other oils. And then how it is produced, if you're buying it from a cheap vendor also, and then also because you will be using some substances which are not pure, and these are actually causing severe damage to the lung. And there were multiple reports from various countries coming out in 2019 that it caused severe lung damage, and people and youth are landing in hospital with a very bad respiratory condition. So, and they were going on ventilators also. And that's why none of the e-cigarettes have been approved by FDA for use for as a modality for quitting smoking, for the cessation of smoking, and that is why, and it's banned in India for that matter. So it's supposed to be less harmful, but then it's not harmless. Let's be clear on that. It's not harmless.
I think that's a very, very important point. There's like there is a spectrum. Like harmless is at a very, very different end. This is still causing harm. It might
Yeah.
be slightly better than a cigarette, but it is still causing harm somewhere in the body.
Yes.
Have you had patients that had an issue because of vaping as well? Have you met anybody?
No, 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 none I've seen, but we've read it, and there is evidence that it shows that a link between the two. Also, um, it's very prevalent in South Asian country. It was very prevalent in the South Asian countries, the use of vaping, and that's where the reports have come in from. Also, nicotine, when you are trying to use nicotine in e-cigarettes, you're trying to normalize the smoking behavior. Now you see that it's so prevalent, that vaping is so prevalent, that you're actually, renormalizing the smoking behavior, and you are just, and there is always a concern that if you get so much dependent on nicotine, that ultimately after you switch to e-cigarettes, then you can again will switch back to cigarettes, the normal cigarettes, because you're getting dependent on nicotine. Ultimately, we are
Correct.
giving nicotine in one way or the other. We are
Yes,
trying to reduce the adverse effects of a smoke of a cigarette, but then we are giving that nicotine, which is the addictive substance, which is actually which is because of which the person is hanging on to cigarettes. So yeah, we are
absolutely.
renormalizing that bad behavior
And
and
I think
bad
that's so
habit.
interesting, right? Because it's like you said, it's a habit, and we are saying now this is fine.
Yeah.
It looks like a USB drive. It is so simple. You can put in your pocket. You don't need a lighter. You don't need anything. And people were sneaking this around. So you're absolutely right. We normalized it, and now we have to realizing that no, actually, this is not necessarily good for us. We need to slowly start moving away from this as well.
And
Um,
yeah, that's why, yeah, as you said, that it comes in USB drive, pen and mod, and ways where it you can't really make out that it's a
you can't make
e-cigarette or
up.
what.
Hello, hello, hello. It's been another great week on the IVM Podcast Network. On Think Fast, Varun and Suchita discussed the Twitter sting operation and Jack Ma pulling out of Paytm. On Cap Gemini's Techipedia series, Shailaditya speaks to Anand Chandramouli and Deepak Solanki about sustainable harvesting practices through digital farming. On the Wire Talks, Siddharth talks to author and translator Navdeep Suri about the partition and the Jallianwala Bagh massacre. On Marathi Khidkitun, the Deshmukhs explore how animals and birds gauge their sense of distance in the environment. And on Big Talk about tiny humans, Devi Shobha and Meghna explain the right way to talk to children about sex and sexuality. We've got some exciting news for you. IVM Podcast has launched merchandise and our first line is out now. Head to the IVM Podcast website and click on the shop tab and check out the first collection of t-shirts. Do follow us on social media as well. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Also, don't forget to rate us on any of the platforms you're listening to us on, whether it's Spotify, whether it's Apple, wherever you do that, that is really helpful for us. And do remember, you can also check a lot of our shows out on YouTube. If you go to ivmpodcast.com/YouTube, you get a list of all of our channels. We're also doing a small listener survey, so please do help us out with that. If you go to ivmpodcast.com/survey, it'll help us understand a little bit more about our listeners. And finally, we'd like to thank our sponsors this week, SBI Life Insurance, Jupiter, a digital banking app, and Capgemini. Get the future you want. Thank you so much. Without you guys, this wouldn't be possible.
So, doctor, like, I remember when we were learning about smoking, and I think in school also, people were talking about secondhand smoke, secondhand smoke. It was something that we used to play on our mind. Does the same thing about secondhand smoke apply to vaping as well? Because in vaping, you see so much smoke coming out. And is there a difference between, secondhand smoke and cigarettes, secondhand smoke and vaping? Have you noticed anything in research?
Yes, very much. So, secondhand smoke from vaping also affects. See, ultimately, the smoke, it's not just nicotine. That's what people believe, that it's just nicotine. No, there are multiple elements that go into making it. There are oils, there are flavoring agents, then there are other chemicals also, and we are inhaling all of that. We are so scared of the polluted air, we keep talking about that, and we are inhaling all this. And when it's in just one room, in just one closed room, the other person who's sitting next to you, and maybe who's even far away, he is also inhaling. And these things, what it see, anything going to your throat will irritate that area, would irritate that that space, and it will lead to increased chances of infection and decrease your immunity, and then it will cause inflammation. That's what
Hmm.
inflammation is, basically the swelling and the reaction that our body um, uh, that our body mounts to any particular irritating agent. So yeah,
Why do they
so
say the
it's maybe,
secondhand smoking is worse than smoking?
I would not say it's worse than smoking.
Hmm.
So maybe yes for the person because he's not doing anything and he's just a passive
Innocent little
smoker.
thing. Correct.
Yeah, he's just a bystander. So it's
Hmm.
not worse than smoking. But yes, it has got multiple harmful effects, which we don't realize what we are doing to the person who's sitting next, who's in the same room, and who is in the same house. And as a matter of fact, we don't see parents, they don't think when they're smoking about their kids, about their children, because it's well established that
Hmm.
childhood asthma, it's 50% chances increases when any one of the parent smokes in house. And why is it so? Because again, it decreases our body's immunity. When that child inhales smoke, it irritates that area. It causes an inflammatory reaction. These children are more susceptible to viral infections, to respiratory infections. And if at all they get this infection, they will have more severe disease. They will have more frequent episodes and they will have more severe uncontrolled disease. They are more prone to wheezing, cough, mucus production, and asthma in future, because you see, you have to understand our lungs, they develop even after our birth,
Hmm.
more so in the first 5 years of life, but they go up to 8 to 10 years of age also. So our first 5 years of life are very crucial, and if we expose our kids to smoke inside home, that's going to be very hazardous to them, especially asthma. And if a mother smokes during the pregnancy also, that child is also at least 3 to 5 times at a higher risk of getting asthma than any other normal child whose mother is not smoking. And if the mother is smoking more than one pack actually a day, then the child is 8 to 10 times at a higher risk. So that's
Wow.
how grave, yeah.
Of asthma, even though the baby is in the uterus.
Yes, it's getting absorbed in the blood. Ultimately, we are not just inhaling it. Everything that we inhale is getting
Hmm.
absorbed in your blood also, and it's passing to the child too.
This is so interesting because we normally never think about it in this way. And we never, like somebody smoking there. I remember when I was young, we used to go to the, like a disco, and everyone was smoking there. You would come back and you would have to, like, probably burn your clothes because they used to smell so bad from all the cigarettes. We never ever thought about this secondhand smoking in this context, right?
So there's third hand smoking also.
What
You
is
know, that
third hand
smoke,
smoking?
yeah, so the smoke that gets on your beddings, your clothes, and if you inhale those particles, even third hand smoking is there.
No, really. So
Yes.
it is first. So first hand, to matlab you're doing this to yourself. Then
Yes.
second is that you're around somebody who's smoking. So there's smoke in the air. And then
Yeah.
third hand
Yeah.
smoking is the smoke that resides on beddings and
Yes.
curtains and all
Beddings,
of that.
pillow covers. Yeah. Yeah.
Oh, so that also causes irritation, asthma, and interesting, interesting. Um,
All
so
this
doctor,
basically yeah,
hmm,
exposes you to increased chances of respiratory infections, increased chances of illnesses, and ultimately decreased lung function.
hmm. What is the role of nicotine? If you can explain to us, how does this molecule work in our body? What does it do? Why is it so addictive? But how is so much of our population addicted to this one substance?
So nicotine, it acts on the brain receptors, and basically it gives us pleasurable effects. You feel, so once you smoke and the nicotine goes into your blood, you and it's absorbed, it starts acting. You get high and you feel better. You feel good about yourself. You overall go in a better mood, and yeah, you feel elated in
Hmm.
general. Euphoric maybe not, but yes, elated in general. And that's why people, these are triggers for smokers also. Stress situation, having caffeine, having alcohol, these are because you want to feel good about yourself, and want your brain to function, and actually it does. So nicotine does, it increases the brain receptors, and people who smoke, they have better cognition. They have, they're supposed to be more intelligent, which is just pseudo intelligence, but that's how
Hmm.
it is. That's how it activates the whole brain receptor. But that, we have to realize it's short lived. So
Correct.
once you've inhaled one smoke, once you've taken one cigarette, then you would want to have that effect. It will not last for long, and to get that effect, to get that pleasurable effect, you will go for another smoke. Then you will go for another smoke. That's how addictive it is, because you want that pleasurable effect. You want that elation. You want that high feeling. Yeah, so it's
And
short lived.
And the harmful effects of a cigarette, do they start right from the first cigarette that you take? Does it slowly build up? Have you noticed the difference in this? Like somebody, tried a cigarette once. So is there something they should be worried about? Is there a, a difference in, one pack a day smokers, two packs a day smokers, one cigarette a day smokers? Have you noticed any of that as difference? And
So definitely, yes, there's a difference. There's a huge difference on how many number of cigarettes you are smoking in a day or a year. That actually the risk factor of any disease varies according to the number of cigarettes. They're obviously not that you just take one smoke and you are now exposed to the harmful effects of smoking. No, it's not like that. It's a gradual process, because we are that amount a certain amount of smoke and certain amount of chemicals have to go inside your body and cause the modifications. But uh, but the hazardous effects are huge. They're numerous. Again, not we're not just talking about cancers. We are talking about multiple other diseases. Like for matter, let's just talk about lungs. In
hmm,
lungs, it causes something as asthma. It causes something known as COPD, which is like asthma, but where your airways they get blocked and narrowed. That depends on how many cigarettes you are smoking in a day. Then it causes increased susceptibility to viral infection, increased severity of these infections. Then in COVID also we saw that smokers, they were having, if they were having severe disease, and if they recovered also, there was a slow recovery for them.
what
And there were multiple lung changes that we could see in post COVID cases, people who were smoking. They were
hmm,
taking a very long time to recover from the disease. Then in it causes more of reflux disease. Causes more of acid reflux, ulcers in your stomach. It causes decreased fertility, especially in women, erectile dysfunction in men. It causes, if a mother is smoking, low birth weight of a child. It causes weakness of your bones, so it affects everywhere. Oral disease, in it causes staining of your tooth, yellow to brown, yellow to actually brown, we see in heavy smokers. There is bad odor of the person who's smoking, bad taste he'll have reduced taste sensation. And that's how
hmm,
the trigger works. If you will see people who are chain smokers, they will have tea also and smoke, they will have together, because what it does, that they will have reduced taste sensations. They will not get the good effect, the good taste of tea. So they'll take one cup of tea, then they'll smoke, then they'll again take one cup of tea and then they'll smoke, because there's reduced taste sensation, there's reduced absorption. And that's how it goes hand in hand. It causes change in your voice. So your voice become more deeper. You will have more voice fatigue, you will have more discontinuation of your voice. Then it changes the oral health completely. You're more prone to throat cancers, you're more prone to getting dental caries, you're more prone to getting loosening of your tooth and tooth decay. So all these gums, the gums will become weak, and caries, plaques, all of this are seen in smokers. So
my God, it's
has
one laundry list of things.
yes, and I'm
We
not
only
even done.
normally thinking lungs, 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 lungs. It's actually on huge list of things that start affecting us.
Yes, it affects everywhere for that matter. And heart is something we have not even talked about. It actually
Correct.
clogs the arteries. It causes high cholesterol level, clogs the arteries. These
Is this
smokers are
because of
they're more
systemic
prone.
inflammation?
Yes, they're more prone to, yes, systemic inflammation. They're more prone to getting hypertension. They're more prone to getting heart disease, heart
Mm,
attacks, heart failures. They are, because it works in multiple ways. It triggers
mm.
a lot of reactions in our body. So heart, lung, oral, throat, bladder, food pipe, stomach, everywhere, everywhere, and reproductive system definitely,
And reproductive system. So this is
even
something.
bones.
How does it affect the bone? Because the absorption of our food is far lesser.
No. So again, it comes down to immunity and the inflammation. It
Okay,
decreases the immunity, increases the inflammation. So although the reports are rare, but then we have found that these patients, they have weaker bones.
fantastic. Okay, so there's one laundry list of things on why we should be avoiding tobacco products, especially smoking. We focused on smoking as a per se. In our next episode, I want to deep dive into what can be done about this. How can we reverse this if there's any way that we can do this? Say somebody says
Sure.
I'm going to stop after listening to Dr. Mittal's podcast. What can I start doing after that? So I think in a second episode we're going to deep dive into that aspect.
Yes,
Dr.
sure.
Mittal, any aspect on the cause and the effect that's taking place in the body that we did not touch upon that you would want to communicate to our audience?
So I think more or less we have spoken about everything. Voice, heart, oral, and lungs and reproductive. Yes, more or
So I
less,
think
yes.
these are the super
Yes.
things. All right, fantastic. So do join us in the next episode where we're going to cover what can you do now? How can you get out of this addiction? And what are the aspects that we can do to reverse the ill effects of smoking? All
Yes,
right.
because we do realize that, it's very difficult to stop smoking. It's not that difficult to avoid alcohol, but it's very difficult to stop smoking because all your withdrawal effects, they're psychological. They're not physical. They're
Mm,
psychological. So you need to have great willpower. And also you should know how you can go about quitting smoking because there are multiple withdrawal symptoms which are very disturbing, are unpleasant. People feel irritated, they feel restless, they don't get sleep, they feel constipated. There's weight gain also. So yes, we should be talking about how we can, go about quitting smoking.
quitting smoking. Absolutely. Thank you so much for joining us. Dr. Mittal, is there any place where people can, reach out to you, continue this conversation with you? Are you available on social media or email if they need to get in
Yes,
touch with you?
through the Sir H.N. Reliance Foundation, we have an Instagram page, Facebook page, and they can connect with me there. I'm available all
Perfect.
the time.
We'll put the links in the show notes below.
Sure,
Lovely.
sure.
All
Thank you so
right.
much for inviting me.
Thank you. My pleasure.